Hearing impairment. Definition: hearing impairment, defective but functional hearing. Deaf, unable to understand speech, even with the use of an aid. Frequency, length of the sound wave. Intensity, measured in decibels. Incidence and prevalence. Approximately 31.5 million deaf and hearing impaired persons in the United States. 66% of those affected are age 65 or older. 1 in 6 persons age 41 to 59 have a hearing impairment. 2 to 3 cases of congenital hearing loss in 1,000 live births. Hearing loss is associated with a number of other disabling conditions. Cleft palate, 90%. Cerebral palsy, 20%. Down syndrome, 70%. Environmental causes are increasing. There are classifications, usually by severity of loss, as measured in decibel loss. There are types of hearing loss. Conductive hearing loss. Its injury or disease interferes with organs that conduct sound waves through the outer or middle ear, usually consistent over the entire range of sound. The person benefits most from the use of a hearing aid. Speech is soft and low. The person hears own voice louder than that of others, usually caused by obstruction of the ear canal, by a serum or foreign object, perforated eardrum, otitis media, otosclerosis, or congenital malformations of the ear. The other type is sensory neural hearing loss, malfunction of organs that perceive sound. So sensory hair cells of inner ear, auditory nerve, auditory center in the brain. The most common causes is the aging process, presbycusis, hereditary disease, noise damage, childhood viral infections, skull fractures, intracranial tumors, oxidotoxic drugs, and RH incompatibility. It involves loss of sensitivity and acuity in one or more frequencies, usually high frequencies. And if the individual wears a hearing aid, sound is conducted by air, speech is loud, and the person cannot hear their own voice. The etiology is prenatal or congenital. There could be genetic defects, infections, RH incompatibility, certain drugs, unknown causes, environmental noises. It can be acquired infections, mumps, measles, hereditary conditions, trauma, chronic use of drugs, aspirin, noise exposure, pathology, brain tumor, or stroke. The signs and symptoms and clinical manifestations may lip read or focus attention on other facial and nonverbal expressions, speech, reading. Speech may be characterized by modulations, pronunciations, or grammatical structures. They may use sign language, the American Sign Language, ASL, or finger spelling, American or manual alphabet. They may turn the head to one side if the loss is unilateral, may frequently ask others to repeat phrases, or may provide an unrelated response to questions or comments, may not acknowledge having a hearing loss. Oral manifestations, not generally seen with hearing impairment unless associated with a syndrome like rubella syndrome. Prematurity or rubella may result in enamel dysplasia, and bruxism may be evident.